Good evening, ladies and gentlemen. Welcome to Team Training Tuesday. I also like to call it Applied Neolife. And we are in the month of April. So I thought today we would turn our focus on our children. My name is Essa Zanambasi. I am the hostess on this platform. This has been going for over 2 years now, and I sometimes marvel at how far we've come. I am a mother. I am also a grandmother, and by training, I'm a medical doctor. And as I was thinking about what to discuss this evening, I realized that our children depend on grown-ups for their wellness, for their health, and for their futures. So I thought to myself that maybe we should discuss from that point of view that we adults must take that responsibility very, very seriously. And perhaps I'm going to explain why. I just want to let you know that I have been involved with a company, I believe it's the world's leading health and wellness company called Neolife. Okay, so raising children is not child's play, literally. And once one decides to be a parent, it means that everything around that child depends on decisions that you choose to make. And so it's really important that you know how to make decisions. I will focus mainly on nutrition, but Neolife, if you know the company, is the world's leading, and it was the first company to also go green, in the sense that it brought to us non-toxic cleaning products and skincare as well. And a little bit about my story, that's exactly what I was looking for. I realized that as I was raising my children, I needed to make the home safe and non-toxic. And so I was looking for cleaning products. So for the guests, you are most welcome. If you are here as a guest, welcome. I hope you enjoy what we have to show you. And after this presentation, you will please ask the person who called you to log in to get more information. Why it is crucial to establish good habits early is because malnutrition in childhood, especially in infancy, can lead to permanent effects that negatively interfere with normal growth and development. And also, children, because they're children, have lower nutritional reserves to draw upon. And if intake and absorption of nutrients is inadequate, then obviously they'll have no reserves whatsoever. So in the event of anything that can cause a lot of stress, such as trauma, burns, infections, in the face of malnutrition, all those can be aggravated. So we all know the general signs and symptoms of poor nutrition. As we think about it, we can recognize a child who is short, who is thin, who is dull and listless, who's always sick because of a weakened immune system, whom you have to beg to eat. And it is even worse if the result of poor senses of taste and smell are that their appetite is poor. And and then of course, A big thing is mood. If there's a lot of irritability and anxiety, and we see that all the time. Now, detecting malnutrition these days is not as straightforward as it was when I was at medical school a long, long time ago. These days, it is very difficult to detect malnutrition. Modern diets are the culprits because there is an ongoing, never-ending cycle of a lot of calories. In other words, foods that are very low in nutrient density, yet they're very high in the wrong type of energy. So we are getting a lot of overweight and obesity. And today, the body's ability to store fat has led to a lot of negative health outcomes that start in childhood. And so I hope you can appreciate the responsibility of adults. And I think this is a very important topic that we shouldn't take lightly. Malnutrition manifesting as childhood obesity and chronic inflammation is a big problem, and it is becoming even worse because of the fact that these days, unfortunately, both mother and father, if it's a family unit, if there's such a family unit, find that they have to leave the house to go to work, leaving the children with other people to look after them. It isn't like the ideal situation where the mom took everything to made sure that the children were well taken care of. On top of that, now, the food that we are eating is highly processed, and the children are entertained by gadgets and television and things like that. So there's inadequate physical activity. And over and above that, because of the high processing of food, we are finding that there's a lot of hormonal dysfunction. The hormones are not working very well right from the beginning of children's lives. Over and above that, there is a link to exposure to toxins. As you can well imagine, more and more toxins have come into our daily lives. So as little children grow and face puberty, I hope the picture on the screen is not as surprising. It might be shocking, but if you look around you, even well-meaning people might have situations where their children have ended up looking something like that. And it is quite scary because as the children look forward to adulthood, all they're seeing are adults that look like that. And so we need to introspect and seriously say to ourselves, what are we going to do about this conundrum, this challenge that everybody is facing? Because we can't carry on with business as usual, and yet we see the same set children looking at the adults and the adults winding up in hospital with all sorts of situations. So examples of negative health outcomes from childhood include crowding out of the space where organs inside the body would have grown if there was proper growth. So growth disorders. And then we see children who might have stress and strain on their back, their legs, their internal organs, and so develop symptoms that can then become a drain to the family later on as they move from pillar to post, seeking medical attention or even surgical attention. And then metabolic diseases like insulin resistance, leading to prediabetes and diabetes, increased susceptibility to infections. Now, we shouldn't be shocked when we think about the adults who have developed heart and blood vessel diseases in adults. It starts during childhood. And then other things like psychological situations and pregnancy complications. So when you think about it, the significance of that kind of obesity that happens in the middle of the body, it's actually an indicator of a metabolic syndrome, which involves diabetes or prediabetes, high blood pressure, high cholesterol levels. We call it dyslipidemia, meaning that blood fats are totally out of balance, and that leads to various tissues being affected, and obviously weight gain. So let's think carefully. Let us not just say, oh, well, it's okay, all people are looking like this these days. It's not okay. It's really not. Now, in addition to all that, the hormonal imbalances that happen early, women and mothers and families and doctors and nurses are wondering, why are we seeing girl children with abnormal menstrual cycles? Why are we seeing a lot of emotional challenges? And then, of course, when we think about emotional challenges, we might have behavioral problems developing, such as food addictions and persistent complaints of boredom, and then they will start looking for ways to deal with their boredom with activities that might not be very savory, as it were. Okay, and all that can be heightened by inadequate intake of certain nutrients and minerals. So we have things to think about seriously. We should be concerned about the effects of abundant, convenient, and highly processed foods that cause endless cravings and overlooked chronic malnutrition. We really must be concerned, and let's not keep quiet about it, please. Now, there are other things that I want us to consider, things like allergies. Again, a factor of our food supply today and the fact that we are not getting the nutrients as we should. And then breastfeeding. I talked about mothers needing to go and work, so fewer and fewer babies are getting adequately breastfed. And then emotional causes, such as all the anger, anxiety, and everything that happens as a result of the modern lifestyle. And that can be heightened by low immunity as well. So when we think about allergy, intolerance, and everything, let us think about it in a very holistic way, right? Because a lot is going on. For example, not paying attention to chewing food properly because everybody is in a hurry to eat this, fast food and carry on with life. If there are particles of undigested food that enter the bloodstream, that can cause a reaction. And then all sorts of things can happen, and we need to be so mindful and perhaps take a few steps back and slow down. So that's the picture of the gut. I like to show this picture for the simple reason that I need us to appreciate that lots of things coming into the gut can lead to disruption of the gut lining or the cells of the gut, so that a healthy gut can become a leaky gut. For example, if we start early to give our children antibiotics and all sorts of food preservatives and colorings and all that, that can lead to a leaky gut. And that sets up a cycle of diseases, and we end up creating a big challenge to that particular child. So what I'm saying is, let's be mindful, very mindful. And let's talk about it and let's discuss it. So there are manifestations of delayed reactions to disrupting the gut, and they will appear as symptoms such as irritability that I've mentioned, an irritating cough. Now, an irritating cough is the body trying to clear something that is not of the body. But what do? We quickly medicate to stop the cough, okay? Persisting or unexplained or fatigue. And then we might get irritated or impatient and think our child is being lazy or is demotivated, and then we create a situation. So let us be mindful. Let us just be very observant as parents and grandparents. Let us even watch out for things like a rise in pulse or temperature. And here are examples of manifestations or symptoms that I'm talking about. Just a summary of them: nasal congestion, cough, wheezing, itching, skin rashes and hives, bloatedness. The child might not be able to say, I've got a headache, but if you see that they're irritable and fatigue. So all this is pointing to one thing, that we mustn't be too quick to medicate, particularly children. Okay, there are times when we can't avoid it, but let us take an example. For example, wheezing, and we assume it is asthma, and then we give the drugs for that condition. But those drugs have side effects, okay? Such as mood swings and inability to sleep and jitteriness. It might be something in the food we are buying that is preserved and colored with colorings, and all those might cause challenges. So how do we coax our children, convince our children to eat real food? Okay, food like that. How do we do that? It's not easy. I mean, any of you who are on the call and have had little children or grandchildren would know that to try and strike a balance and provide adequate protein, adequate complex carbohydrates, and not the highly processed ones that will cause the blood sugar to get totally out of order. Adequate, correct fats. Striking that balance is very difficult, very difficult. Now, in the month of April, we want to also remember that it is Autism Awareness Month. Autism and other conditions such as attention deficit and hyperactivity disorders. I've mentioned allergies, anxiety, autoimmunity, and all those things that happen. One can actually put them together because the root causes are very similar. What we need to concern ourselves about. So I thought I would combine the presentation and talk about them and be aware that in April, we actually focus a little more on those conditions, particularly autism. Now, the thing to always remember is that nutrient use by the body, the way the body uses nutrients, that is influenced by internal factors such as our genes, our genetic makeup. But that is a small factor compared to bigger things, rather everyday things like the diet, the gut. I've pointed out the importance of making sure that we don't disrupt that gut, exposure to toxins, and the stress of growing up, particularly if there is any reason for anxiety, such as the adult that the child is depending on being not as stable as they might be, due to circumstances most often beyond their control. But I just want us to be aware that these are factors that are impacting on our children. Every individual is unique, and the approach to every child should be unique as well, individualized. So as we connect these dots, this has been a very thought-provoking, I hope, discussion. And as soon as it's over, it isn't a long one at all, we can have a few minutes to discuss. But it is important to learn to interpret signs and symptoms. And even if the children are not your own, but we are now trying to pull together as a family in this opportunity and this family that we call the Neolife family. And our goal is to make the world a healthier and happier place, and also to offer to mothers and fathers a way to create an income so that the situations that lead them to perhaps not pay as much attention to their children can be helped because there's an extra income coming in. And for details on that, we are very happy to share with you. So just watch out for signs and symptoms such as your child being constantly tired or irritable. This could be due to the diet that has a lot of inflammatory foods that are leading to the wrong type of inflammation and the lack of foods that would control that inflammation. And then fluctuating moods, attention, focus, perhaps they're not doing well at school. You might need to actually investigate it a bit more and say, are we eating the wrong food, such as is there too much dairy or too much wheat products, and the child is actually they're causing discomfort and allergy. And then food sensitivities, because we know that children with attention deficit and hyperactivity disorder, autism, anxiety, and autoimmunity, all are particularly sensitive to those situations. So with that knowledge, let us never forget the fact that the gut and the brain are so closely connected. They're so closely connected that symptoms can happen, and it is crucial to be aware and also to supply adequate nutrients to make sure that the body can respond normally to inflammation, to make sure that the cells are working well and that the child is growing properly. And as we've mentioned, it has to start right at the beginning. And there's good proper detoxification as well, digestion and detoxification. So adults, can we promise ourselves that we owe it to the children to gain all the knowledge that we can? And If it will mean getting involved in this family, please, you are most welcome to do that for the guests. So I just wanted to, I've talked about autism. Let us, I'll probably show again, but attention deficit and hyperactivity disorder that I've been talking about. The hallmarks of that are difficulty paying attention or controlling behavior. Then there's hyperactivity and lack of attention, impulsivity. Now, it has been talked about in the mainstream for a long, long, long time. And people have almost again said, well, there's nothing we can do about this, okay? But I beg to differ. If we consider that perhaps it is being diagnosed because it is by observation and by the teachers that our children are entrusted to, it might be necessary for us to now ask the parents that what solutions should we be coming up with, okay? So diagnosis may be made hastily with incomplete information, and yet if we look more broadly at nutrition, toxins, and the lifestyle that is happening, we should find solutions. So the reason we are talking about this is we need to be concerned because the future of these little children could be curtailed or stunted by the choices we make early in their lives. And we want them to become good citizens in the future. So let's give them hope. Let's give them as much hope as we can, as early as we can. So I've mentioned ADHD, and now the autism spectrum disorder, which we are observing this month in April. It is a developmental disorder that impairs the ability to communicate and interact. It's a very broad spectrum. It is very broad, so you can look at it there. It has many aspects to it. And now I want to turn our attention to some possible solutions. And the first is to talk about protein. And traditionally, children are woken up and given a high carbohydrate diet, usually porridge or something of that nature, with very little good quality protein. And that is something that I want us to consider changing. And I want to share with you possibilities that we have here. Okay. Sorry, let's just get back. Okay, so protein, good quality protein, actually increases the rate at which the body metabolizes. We call it the metabolic rate. It is a good source of fuel, and it also participates in growth, in hormones, in enzymes, and generally repair and making sure that the body works well. Protein also balances secretion of insulin. That is that hormone that is so important in the way the body uses nutrients. And it also leads to the release of glucagon by the pancreas, and that is an important hormone that mobilizes fat from tissues to be used as energy. Now, fat is a a better fuel for the body than simple carbohydrates. And unfortunately, most people don't know that, so they use way too much sugar, simple sugars, and starches and things like that, that can cause damage in the long run. So introducing now a way to maintain stable blood sugar and good quality supply of energy, particularly important in children, and especially if there's autism and attention deficit that is also involved. But let us consider all children, because mild blood sugar fluctuations have been shown to cause nerve cell and the brain to become more susceptible to toxins. If there are toxins in the environment, and then there are mild blood sugar fluctuations, then those blood cells, the nerve cells and the brain become more easily damaged. And that is a scary thought. So what protein does, and particularly the protein that we would like to introduce you to, if you haven't yet used it, we call it Neolife Shake. It has all the 22 building blocks of protein. We call them amino acids. But most importantly, it maintains blood sugar in a narrow range that we call the glycemic control zone. That is very important for good health. If it was just carbohydrate and porridge and things like that, cereals even that are highly processed, there's high glycemic dips and peaks, and that is not good for one's brain health and overall body. Then I want to introduce the importance of essential fatty acids, and just to highlight the deficiency and perhaps what you can look for in children and adults as well. If you see that a child is always excessively thirsty or has a dry skin and has developed eczema and maybe signs of allergy and asthma and even anxiety and irritability, those are signs that essential fatty acids may be deficient. So for the guests, we want to introduce you to our flagship product that we call TreeNN. Important for children. And in children's preparations, if the child is too young to take this capsule, we have it as well in our Vita Squares. TreeNN is essential, and generally essential fatty acids are converted into prostaglandins for use by the body in various pathways of the body, including the building of hormones. So we need to know that it is important to supply them. Our diets today do not supply them. So here's another set of essential fatty acids, and we call those omega-3. And so today I've just highlighted the important things that children must not do without. So protein that I've shown you, the essential fatty acids, there's TreeNN, and there's omega-3 as well. And then antioxidants to supply the fruit and vegetables, and to close that gap, we have children's antioxidants as well. So in summary, here we are. All of us would love to do this cycle. Oopsie, sorry, let's go back. Have healthy people in their early childhood who will then successfully grow into young, between teenagers, between 12 and 20, without any worry or anxiety, and then grow into responsible, clever, resourceful, highly motivated adults as then they look forward to their golden years. That is the ideal, and that is what is possible with this opportunity that we call Neolife. As I pointed out, today I wanted to focus mainly on the nutrition, but we have cleaning products, we have skincare as well, that you will get to hear about as you associate with us on this journey. Thank you so much for being here. I'm going to stop the recording so that you are welcome to discuss.